the rush hour. 5 o'clock is the killer for the parking and getting up. Anyhow, I just want to emphasize on, we're not going to leave out the external surfaces, lateral and sagittal, just in case. As an example, you won't get surprised, I'm going to be tagging right there. So you got to ID, of course, part 1, part 2. ID the structure, and part 2 will be a function relative to that structure. You follow me? So that is a relationship of 1 and 2. Any of those areas. If I'm going to be tagging right that region or this region, so you're going to be getting involved. What region is that? ID those landmarks to begin with, and then function of that landmark. Okay? So that is the lab lecture material that exactly is trying to connect to each other or happening. Somatosensory versus the primary motor, that premotor, frontal lobe, such and such and such. Same as sagittal. Okay? So the fact is that we must be definitely very clear, anterior commissure versus the posterior commissure. But if you remember from last lecture, there was a table regarding the connecting fibers, right? With the cerebral cortex. Anterior commissure and corpus callosum was there, but posterior commissure was not. Okay? So posterior commissure was not a part of communicating fibers of the cerebral tissue. Position of the mammillary body versus the pituitary gland versus pineal gland. Interthalamic adhesion. Position of the fornix. Now, here is uncus. Cross section of here, what nucleus you're going to find? Amygdala. What the amygdala does? Anybody? Damage of the amygdala, not properly getting the blood supply in that region, what do you think is going to happen? The side effect of the amygdala. Outrage behavior, anger, right? Road rage. Real life. So trying to connect, hopefully it sticks with you for the lifetime future, you know? So what exactly gyra is here? Parahippocampal gyrus, right? Somewhere, as I said, when you're going to do a cross section, not of course here, you're going to be picking up the baby ducket on the coronal or horizontal section. So all this area that I'm circling around will be called what? Limbic system. The components of the limbic system, the function of the limbic system. Why I'm just saying that, I may be tagging this cingulate gyrus, but the question is about function of that tag. Make sense? This could be a straightforward lecture exam question. Right? Simple and straightforward. Basal view, Mickey Mouse. Position of the Mickey Mouse versus the mammillary versus the pituitary gland versus optic chiasma, optic tract, optic nerve. All surrounding here. So this is the midbrain portion, but the circle of Willis is going to be located right there, right? See how many surrounding structures could be affected by a malfunction or occlusion or bursting a single vasculature in that area. Now, back here, you're going to be picking up those geniculate, whatever exactly different segments of the brainstem level posterior view. Corpus callosum. Uncus. Position of the lateral ventricle. So horizontal section right in here, if I'm passing basically by the thalamus, as a result you're able to catch up anterior aspect versus the posterior aspect. But if I'm higher up, you're seeing the whole lateral ventricle in one piece. So horizontal 6, you see a nice chunk of thalamus. So the line I'm drawing right here, that would be the horizontal 6. You follow me? So if I come higher up, I may be losing some of the structures. If I go down, I may be losing certain landmarks or nuclei or structures. But that is horizontal 6 because it runs right here. The third ventricle is going to run in the middle of it between the two lobes of the thalamus, same as here. That's a coronal, but you see the baby dot nice and beautifully, right? Hippocampus. That means you're somewhere in here in this position. Hippocampus. You already master on this. So anything happens right by the foramen magnum or above that is going to be clogging or blocking these openings, like Indian Malushka, singular the one, is going to be accumulating of this dark matters, CSF, within the ventricles. Subarachnoid space, and eventually you are very clear from the growth till now that all that CSF, that it goes all the way down to the tailbone, rolls up, will be collecting back through the granulation, arachnoid granulation tissue, which dumps into the venous drainage or the dural sinuses, and eventually dumps into internal jugular vein. So remember these verbiage on your board exam when you read it. I've had, to be honest with you, as I told you guys, I have several over years and years. Some guys, they come after their course, doesn't matter optometry or the past medicine or you guys, mental. They hear my voice, hearing things, and that's scary, right? That's the long-term memory opportunities. Speaking of that, memory. So if you really go to the lectures, there is a communication understanding you should be having down. Writing, looking at, and writing, talking is helpful for that memory because you're using. I was talking to a friend of mine, another friend besides the neurosurgeon, another neurologist, and I'm like, I feel that I'm becoming a little bit slower. The way I used to talk, the way I used to carry, I am becoming a little bit slow. So what does it mean? He goes to me, go learn another language. I'm like, really? But are you stimulating exactly your memory cells, exactly how it's going to be coming back, and it's going to be affecting your speech, your memories, you name it, your function. So exercising, and that's why you see a lot of elderly and I'm old. You're picking up all these games, right? Some of the math games, and you're playing with all that memory to improve. And what goes around comes around, whatever exactly is happening. Well, long story. This is the main plate. That is your plate. You know about the nucleus. I just went through all of it practically. This picture is for your understanding. What it really shows, this is the temporal, is the space within the temporal. That's the lateral ventricle. That's the terminal end of the C shape. Now, what it really does also is going to have the hippocampus formation is running right by the lateral ventricle in the temporal lobe, parahippocampal gyrus. So we're inside of the temporal lobe, and you're picking up all these bundles that are rolling on top of each other. What are your own ones? Superior colliculus, inferior colliculus, pineal gland, mammillary body, septum pellucidum, corpus callosum, head of the body nucleus. I wouldn't pick up on this view, I'm just saying the relationship. Hippocampus, fornix, two bundles. It runs with the hippocampal formation, with the hippocampus, but it's not a part that runs with it. This picture shows that it's connecting to the hippocampus, ends up by the hippocampus itself, and proximity to the amygdala, mammillary bodies. You know already about the whole cerebellum cross-section. This wrinkled dark line is famous for dentate. Posterior view, anterior view of the brainstem. Cranial nerve 4 exits out of the midbrain by the inferior colliculus posteriorly. All other cranial nerves are anteriorly positioned or laterally positioned by the 10 or 11. 4 is the only one that gets out posteriorly. The rest is right here, anterior or lateral. So here's cranial nerve 4, inferior colliculus, superior colliculus, pineal, dentate. Tonsil versus nodulus. Orientation. I'm going to start from the bottom up. Step 7. I'm going to have to explain these. You already know. So whatever we're going to be looking at, all these big charts that some of you guys are panicking about, but please pay attention one more time to the region and function of these lobes/gyri. Repeat it. So as a fair tag, I'm going to be tagging here. I'm asking for function. Same as the other two. Transfer temporal gyrus. So, connection of this with speech, hearing, and talking. These are the paragraphs I was referring to. So, must know, highlighted. Wernicke's area versus Broca's motor. Falls by the primary and premotor region, right? So make your life easier. Any language deficit is going to take place. I cannot talk properly. Someone, as your patient sits in your chair, they mumble, they cannot pronounce properly. That results into the motor and premotor control of the language or speech. Understanding, comprehension of the language, and the sound, Wernicke's. So if I'm going to be, well, it's not a really good area, but this is supposed to be the squatting bot region. What area would that be? Broca's, right? This is a nice one. Ars triangle. What is the name of here, this region? orbicularis, palus. I don't use that kind of pictures for sure. It's really not giving you, but it's a good landmark again. It's the leg or squatting body, but it's not as good as it's supposed to be. Right here, but these are nice. What center is this? Hearing, right? But vestibular, I like to break and clear that one up because hearing is a part of this game one more time all around. Unit 2. The vestibular portion versus the cochlear portion, right? Where are you going to find the vestibule connection with the cerebellum, right? So you want to pay attention to that kind of verification. So what blood vessel right here is going to supply this? Anterior, what? Cerebellar? Cerebral. Thank you. As a result, based on the portion of it, if it goes by the frontal and is supposed to be the motor, upper motor neuron, lower motor, I'm sorry, upper extremity or lower extremity? Lower extremity. Perfect. I'll leave this one for dental first. for the outcome. Tomorrow I'm saying the same thing, vice versa. It's so bad. Go to different later on, we talk about, I don't remember what I said last time and what I'm doing right now. So, precentral lobule, please pay attention, it's going to fall into sensory and motor, right? What's the name of this location right here? That's the console. If it's going to extend it down through the foramen magnum, we'll call it as hernia, right? So please pay attention to that. What is the name of here right here? What's the tag? Console, right? This guy? Nodulus. This is space. What is that bone? Supraculiculus. Inferior is not as obvious. What is that bulginess right there? Pineal gland. What is the name of that sheath right there? Septum pellucidum. What is the name of that dark area? Interventricular foramen, right? Are you with me? Perfect. What is this guy? Don't confuse this with this. What is this? Mammillary body. So if I pick up an MRI, the main outline is clear. It's the same thing. Okay? What are those granulation right there? Tissues. Or reflexes. What is that bone? Uncus, perfect. Is it hippocampus or amygdala? Cross section, amygdala. Already mastered it. Your friend, what is this guy right here? That's a nice tag for you guys. Doesn't matter. That's oculomotor nerve. Now, what are the blood supplies going to be surrounding the oculomotor nerve? Posterior cerebral, superior cerebellar, right? Why I'm just saying that? Oculomotor, don't count that is eye, because you and I, we look at the eye, right? So, you want to look at the pupil size, the drooling eyelid, correct? So, it's not just saying, oh, I'm just trying to make sure that you guys are paying attention to those kind of side effects that may be resulted with the vasculatures in this area or any other issues. What is that bump there? Uncus. Perfect. Right here, optic tract, optic nerve cross section, optic chiasma, infundibulum, optic pituitary gland, olfactory. So among all those cranial nerves, there was an exception with cranial nerve 1. You remember what was the exception for? Olfactory. Smelling. What was the exception? If you don't know it, please look up. So, majority of all these cranial nerves communicated with a coordinating center, which is called thalamus. But smell was an exception. Right? So if I'm seeing a little bit of on your face, please look up. Cranial nerve 1. We're going to get my 5. I'm going to be flash based on review one more time. And next week. Limbic lobe, all shaded area. But you should be very clear what gyri, what specific portion falls into as a component of the limbic lobe or system. As a result, the function of that area. So you already know anterior cerebral is the main one, but down below here could be the posterior cerebral, some branches come to play. Repeated. Now, I'm assuming you guys know the circle of Willis and connection and the branches of the vascular and pica and all that is the third game due to the supply region. So last part, we were just what is branch of what, but now we're dealing with the region that they're responsible for blood supply and that kind of factor. So any of these branches you see right here, they're branches of what? Middle cerebral artery, which is a branch of internal carotid artery, which is a branch of common carotid, which is a branch of either brachiocephalic trunk or direct branch of arch of aorta. Why am I saying? Just in case, neck trauma can result into central nervous system defect. So you see these pictures? Another beautiful Mickey Mouse. And I want you to know that certain vasculature sometimes on the MRI is going to be shown as a very dark lumen as this space. Coronal section, right and left hemisphere, corpus callosum, septum pellucidum, fornix. You all agree so far? What's the name of that tiny granulation there? Choroid plexus, right? What is that dark as a nucleus? Body, perfect. We're dealing with a tiny space as a third ventricle. As a result, surrounding tissue would be thalamus. Now here, you got the colostrum, you got putamen and globus pallidus, which falls into two subdivisions. We bypass on that. Here is the insula. And this is a different view of any vasculature in that region would be branches of the middle cerebral artery. Now down below is the temporal lobe, and here's the basal portion, right? This is uncus. You all see that? As a result, this shaded dark area is called amygdala. Coronal view. Basilar artery. So if on the MRI, per se, you're going to see the same image, darker grayish tone. It's the same scenario. Any vasculatures I'm able to pick up at certain areas, so you got to orient yourself coming with that kind of conclusion as the correct answer. But don't forget, from now on, what you're emphasizing on, what are the big landmarks, location of the cortex, what kind of function supposed to do, less of a blood supply, what kind of malfunction. So there were 3 specific paragraphs at the end of today's lecture that you need to pay attention to. One more time, repeat it. Shaded areas versus certain regions. Trunk, upper limb, face, lips, mouth. Wernicke's versus Broca's. Blood supply. Anterior communicating artery connects and runs between the 2 anterior cerebral arteries, right and left. Optic chiasma, right by the anterior cerebral. Repeat, repeat, repeat. So, horizontal plane, I'm looking at this highway. If I'm tagging here, I'm asking for genua. Here, anterior limb, posterior limb. Corpus callosum, corpus callosum, anteriorly, posteriorly, lateral ventricle, septum lucidum, cortex. Look at these vasculatures. I'm seeing a little bit of a baby duck, not as clear. This is the beak, this is the head, it's supposed to be the body. Imagine is there, what the head is. Hippocampus, right? What does hippocampus does? Please pay attention to the function of the nucleus. Vasculatures. Tonsil is here. So here is practically cross-section of the C1, posterior arch, anterior arch. This is the dens of the C2. It's not on your exam, you took the exam for it. I'm giving you orientation. Right above it is the posterior border, anterior border of the foramen magnum. So please pay attention. Inferior alveolar nucleus, medulla. Here is the pons. You're looking at a connection of the pons to our cerebellum, which is not fully shown. Like those wrinkled up structures are going to be different than here. In the cerebellum would be called what? Dentate. One more time. The midbrain. Surrounding circular Willis structures. Hypothalamus. follicular nodule lobe, folliculus and nodulus. Superior, the middle, and inferior cerebellar peduncles. And if you remember, I'll go through the lecture very quickly as well for the review. Please pay attention what kind of fibers. Is it output, input, or both? And which directions are heading to? To our cerebrum, to our pons, to our medulla/spinal cord. Cross section, orientation-wise, cranial nerve 6, 7, and 8, and that will become way nicer structure than this. Here's a cranial nerve 4, trochlea, getting out. Superior colliculus, inferior colliculus, pineal gland, posterior view. That's obex. Fourth ventricle, that space ends up right through here in the center of the spinal cord, central canal that you already knew. Cranial nerve 1, 2, 3, 4 is that thin one coming from the back. You see a little thin line right there, same as here. 5, 6, 7, 8, 9, 10, 11 to the side, and 12 between olive and pyramid. All for a gain for this. Folliculus. What's the function of folliculus? Please look up. Follicular nodule lobe function. I know that you guys are busy, but the game is a catch-up time. Tonsil, vermis, pyramid, medulla, folliculus. What is this? Angular body. Same as here. What is this circle? The thalamic adhesion. What is this? What is here? Not here, but here. Posterior column. Superior colliculus, inferior colliculus, pineal gland. Cerebral aqueduct, fourth ventricle. There we go. Same structures. So it's a fair game. Pick up the same map, right? What is this bump right here? Angular body. Cerebral aqueduct. Membrane pons medulla. Fornix. Pons level, we're dealing with the midbrain portion. Now, if I'm in the midbrain, let me get back. Orientation-wise, I wouldn't pick up anything like this, but I want you to pay attention. If I'm going to be tagging here, I'm asking for middle cerebellar pedal. Perfect. So you see the Mickey Mouse, it means what? Midbrain. You're above pons, correct? As a result, these elongated side columns as a peduncle would be called what kind of peduncle? Superior cerebellar peduncle. So landmark orientation. I don't want to make you nervous, but I'm just trying to say, I don't pick up that. cerebellum, middle cerebellar peduncle, and the nucleus. Just in case, what do you think these elongated thin shades are? Optic radiation or visual radiations? Optic nerve, optic nerve. Optic tract, it shows duplication right there. Now, look at here. If this is the bump that I keep referring as uncus, this zoning would be, one more time, amygdala. If it's the uncus, this dark grayish area. This is a little bit too far for you guys, don't even worry about this there. First, reread the ear. What is that dark spot? Is it position of, what is the landmark for basilar artery? Basilar artery runs anterior to pons, right? So there's only one main vessel right to the midline. Just in case. Now if you're going farther down, I'm in the medulla level, and I'm going to the side, I may pick up right or left vertebral arteries. Make sense? So it boils down to orientation. Medulla, you already saw, the two vertebral arteries are entering through the foramen magnum. In front of the pons, they get together, make up the basilar, correct? Narrow ventricle, the tail of it. What is that white gut spot right there? Aspasia, don't even doubt it. What do you think these two are? Internal carotid arteries. Okay? Depend upon the section, of course, but exactly we're falling to the right position. The dark spot right here, same as here, smoky dark, substantia nigra. Responsible for what? Damage to this area is going to cause what? So I can pick up this picture, put a tag right there, identify, and then the next part of the question is about the function or malfunction of that region, right? I mean, Parkinson's, you name it. Inferior auditory, inferior cerebellar peduncle, position of the hair. What kind of fiber is going to be running here? Is that the pyramidal or extrapyramidal fibers? This is the connected part, right? Now, if you remember, well, I guess I'm going to go back. As I said, all the cranial nerves are fair game. What are these tiny, small nerve ending? Well, lower motor neuron or nerve fibers are going to be located here between the olive and the pyramid. Cranial nerve 12, right? And if you go back to the lecture of the cranial nerve 12, the nucleus was supposed to be somewhere back there. Fibers are coming in this position. A damage to this pyramid could be affecting the cranial nerve 12. Dentate nucleus versus inferior olivary nucleus. Within the olive, within the cerebellum. the last module of the lab. Another map of the coronal section that is duplicated similarly to the real tissue. I'm looking for a new structure that I will pick up. Template 6, basic information. Comparing. Name this, name this, name this, name this, name this, name this. Any questions so far? Perfect. Right here, here versus here. The space, that space back here. Just orientation, guys. So, you've heard me, I am repeating myself over and over. God knows. It's nothing more than what we've talked about and what we have covered. So, as long as you get the proper orientation, you should be absolutely fine. Like the first one, 20 lab exam questions. I'll be starting the lecture review from the unit 2. We're going to be zooming through that. And willing to wrap up and one more final touch by Tuesday, the week from Thursday. Oh, see? I see something here. That's good, right? What is this white line? Anterior commissure. Do not confuse anterior white commissure with anterior commissure. What was the anterior white commissure? Spinal cord, right? Perfect. So cross section, you see that right there. Red nucleus, substantia nigra, posterior V, cerebral aqueduct. So looking at the midbrain, the Mickey Mouse here, superior cerebral aqueduct. What kind of fiber is going to carry? Please pay attention to the lecture. Dentate nucleus. Yeah, it's not as good, but I don't see the uncus. If I see the uncus, amygdala would be a good part to show up. Stuff. So what is this thin line right here? Anybody? It divides two ventricles from each other. Septum pellucidum, right? What is that white line? Anterior commissure, corpus callosum, fornix, septum pellucidum. If I put the pen right in there, whoops. What portion? From here to here, bending form, genuine. It's a part of the uncus as a result amygdala. So cross section, it could be shown on MRI as a lumen. It could be either white, depending upon the chemically treated through the vasculatures or untreated blood supply to pick up a different shading. As it shows us dark or white. And this may be a last week. Cross section of the internal carotid. Lateral to the sonotorsica, lateral to the optic chiasma. Aslar artery. What do you think these white spots are? Choroid plexus. Let's say space right here. Third, between the two lobes of the thalamus, right? Make your mouse number 5. Cerebellum. I guess you're bored, right? All right, guys, have fun.